I'm Derek Chambers. I work for HSE Mental Health as the Policy Implementation Lead. So SilverCloud is unique from the perspective of bringing computer science together with mental health clinical practice, and I think that's the really kind of special thing about the company, from its inception and through its expansion and growth over the last number of years. Digital offers a fantastic opportunity to scale and to provide mental health information, self-help, and then as we progress through different levels of needs that people might have, digital works in different ways, but scale is the key thing that digital health solutions offer us. CBT is tried and tested over decades, but online CBT also is not something that's new. The feedback that we've had from users has been really positive, just because of ease of access. It's on their own terms, it's free to access, it's trustworthy, and it's something that they can also use as complementary to the other support and services that they might be receiving.
Hi, my name is Dr. Aoife O'Sullivan. I'm a GP. I'm also HSE iCGP Clinical Lead in Mental Health. We know that there is a huge increase in the levels of anxiety and depression in the population in recent years, and this has put a lot of pressure on services, both GPs, counselling and secondary care services, and it's very difficult to provide one-to-one counselling for all of those who need it. This has just led to absolutely massive waiting lists in some parts of the country. One way of getting around this is by using digital mental health, such as SilverCloud. So this means it doesn't matter what part of the country you're on, whether you're in Castletownbere or Donegal, your GP can refer you in to the digital mental health intervention. SilverCloud uses evidence-based cognitive behavioural therapy to provide the online therapies for anxiety and depression. It's proven to work with the right cohort of patients. So it's important to say that it's best used for people with mild to moderate levels of anxiety and depression. It's important to emphasise that this is not a self-directed intervention, that the supporter will be there every step of the way with the patient who's completing the modules. So they will be interacting with them every week, and they will be encouraging them to complete the modules for the patients for whom it's best indicated. It's very important for GPs to stay abreast of the most recent digital mental health interventions, because with the very long waiting lists for all of those services at the moment, it makes sense to look at other interventions that are there, that are paid for, that are free to our patients, that don't have the long waiting lists associated with them, and let's take advantage of those services that are available to us.
We have seen a big rise in referrals since the COVID-19 pandemic and in recent years. I think it's a good thing that people are seeking help maybe more easily, maybe people are a bit more open now to seeking help and realising a lot of people share these problems, but it also puts a huge demand on services, because there will be a third of those people, all they will need will be access to some of the tools and the tips, learning how to reflect on their feelings, how to challenge some of the thought patterns, how to overcome avoidance. And so a third of people can be seen really quickly and can get that support, and then will go on purposely to not needing support at that time.
So the clinical team is made up of a director of service, and we have myself as clinical lead, and we then would have the client supporters, who are the cornerstone of the service in that they are writing the reviews that the clients read on a weekly basis to help keep them motivated and engaged with the programme.
The partnership between HSE and SilverCloud is a very important one in terms of building trust in what SilverCloud offers. The relationship has built between the two agencies. The clinician support role is really important in terms of picking up on any risk that might present. That would always be a question that clinicians might ask about. Well, if I refer this client, what happens if a risk issue arises? How would that be dealt with? So I think the fact that there's a clinician support in the background who can identify risk, respond to that, and also refer back to the clinician where further intervention is needed is a really important part of the intervention, the way that it's offered. It helps to build the connection between SilverCloud and the referral agents. I think it ensures that there's a safety net for the clients and that they're going to get support. So they're not kind of left there if a risk issue arises, that there is that kind of package of support around them.
If a risk was flagged 1 week with someone, in terms of their review, I would address the risk in the review and be in touch with them about what's going on, while also expressing empathy and showing compassion for whatever it is that's challenging or whatever risk that is flagged.
The benefits of using SilverCloud are that it's free. You have access to it for 1 year after signing up.
We get people engaging quickly. There's no waiting time, and this can also help minimise waiting times or adding to waiting list pressures within the HSE.
As clinicians, we always want to provide help when it's sought and when it's needed. So a big benefit of this is that clients can sign up so quickly.
To be a part of helping people receive cost-effective, flexible, accessible mental health care and treatment is such an honour, because we've had such a tough time with the pandemic, and it's shown that it has affected people's mental health, and to be able to help people that wouldn't be able to afford therapy is such a privilege.
I mean, it's really meaningful work. There's something about just logging in and just seeing somebody's engaging. I might see like that they shared a message and they've taken something that they've learned from the program and they've applied it in their day-to-day life, and they're noticing a difference. Because with depression and anxiety, it can feel so pervasive, it can feel so personal, and like it's going to last forever, and that there's no way out. So when they get that first glimpse of a possibility that it's going to be better, I mean, that's what it's all for, really. You're getting them started on that first step towards a better life where they feel more comfortable in themselves and more confident in their abilities.
GPs can refer to SilverCloud through a variety of online options. I think probably the most popular one will be the Health Link option, so you'll be able to refer directly from the patient's chart in your GP software through Health Link to SilverCloud.
So anyone can avail of SilverCloud. If they go to their GP, they can also access it via their primary care psychologist, if they're involved in counselling and primary care, Jigsaw or community mental health. All they need to do is go to their referring clinician and ask for them to send a referral to HelpMail.
The person, and it's about wider society and wider community. So services like SilverCloud do that. They cut across, they, I suppose, democratise access to support, and that's what Sharing the Vision is all about.
My message to my colleagues within the National Counselling Service would be to continue referring to SilverCloud. It's an effective intervention, it's really user-friendly and accessible to clients, and it's got clinician support behind it, which clients really appreciate and benefit from.
My message to my primary care colleagues is not to be afraid to refer clients to digital CBT. Don't be afraid of the new technologies.